Title of this week is done by a Korean group and published in BMC Oral Health Journal in 2024, titled Predicting Early Endodontic Treatment Failure Following Primary Root Canal Treatment. It is a retrospective cohort study done to investigate the possible predictors that could differentiate early from long-term root canal treatment failure. It included patients older than 19 who had permanent teeth that had undergone only non-surgical root canal retreatment. They excluded extractions and surgical retreatment cases. Therefore, they had 175 teeth to analyze. Reviewing the electronic records, they recorded the following variables: age, gender, tooth type and location, periapical diagnosis and radiolucency, preoperative pain, type of coronal restoration, time since initial treatment, and reason for visit. Teeth with endodontic treatment failure were defined as those with periapical lesions that required endodontic retreatment or that cause symptoms such as spontaneous pain triggered by biting and/or tenderness on percussion, swelling, sinus tract, and so forth. The potential causes of failure considered in this study included inadequate obturation quality, inadequate coronal status, the presence of untreated additional canal anatomical complexity, instrument separation, iatrogenic perforation, and presence of a crack, and concomitant endodontic periodontal lesion. The cases were divided into two groups based on the follow-up time: short-term, which was under 5 years, and long-term, which was more than 10 years, and the short-term further subdivided into 1, 2, 3, and 4 years. For their results, most teeth showed poor root fillings with no significant difference between the short-term and long-term failure groups, indicating that poor root canal treatment may lead to treatment failure regardless of the time since the initial treatment. The overall incidence of untreated additional canals was 20%, and there was a significantly greater proportion of untreated additional canals in the short-term failure group than in the long-term failure group. The distribution of other factors was not significantly different between the two groups. In the multivariate analysis, the presence of untreated additional canals was correlated with a significantly increased likelihood of endodontic failure within the first 5 years. However, inadequate coronal status, regardless of obturation quality, was associated with a significantly decreased likelihood of endodontic failure within the first 5 years. After adjusting for other variables, the presence of untreated additional canals was significantly correlated with short-term endodontic failure. Their conclusion was obturation quality was inadequate in most early treatment failure teeth, regardless of the time since initial treatment. However, untreated additional canals were more prevalent in cases of endodontic failure that occurred within 5 years than in cases of long-term endodontic failure. Therefore, the presence of a missed canal is a predictive of early endodontic failure.